Hi friends, welcome to Smile Nursing tutorial. Today we are going to speak about the simplified partograph. First, what is partograph? Why should we know about that? Why it is important? See, partograph is a graphical representation of progress of labor and the condition of the mother and her fetus. It helps to identify complications in childbirth such as prolonged and obstructed labor, fetal distress or inadequate uterine activity, hypertensive disorders and sepsis. See, coming to the identification data, first we should fill all these columns. Name, wife of, age, registration number, gravida, date and time of admission, date and time of rupture of membrane. It's very important. Now we are going to see about the patient name Rani, age 25, primary. She came with active stage of labor, that means 4 centimeter dilatation. So that simplified photograph now we are going to see. See, this is coming to the fetal condition. We have fetal heart rate and amniotic fluid. See here two dark lines at 120 and 160. Fetal heart rate normal rate is 120 to 160. Each small box represented with half an hour. See, less than 120, more than 160, FHS indicate fetal distress. So every half an hourly we have to write with the dots like this. See, coming to the amniotic fluid, we have to write each small box I, R, C, R, M. That means I means intact, C means clear, B for blood stained, M for meconium stained. So whether the amniotic fluid is normal, it's clear. So we have to write in the box C. If it is intact, we have to write I. If it is blood stained, we have to write B. If it is meconium stained, we have to write M. See, meconium stained indicate for fetal distress and blood stained indicates for antepartum hemorrhage. That time, each such type of case should refer to the higher center. Next, coming to the labor, we are going to see the dilatation of the cervix in centimeters. When the patient is in active stage of labor, that means 4 centimeter dilatation. That time we should start the photograph. See, first dilatation 4 centimeter, we should plot on the alert line with cross symbol. See, this is cross symbol. So we have to plot here. Now, see, these two boxes indicates 1 hour. 1 hour, 1 hour like this it shows. So 4 centimeters dilatation here. After 1 p.m. here is 8 centimeter dilatation. After 3 p.m. 10 centimeter dilatation. So like this we have to plot the cervical dilatation every 4th hourly. So this is the normal partograph. So I will let you know about what is abnormal partograph. For example, here 1 p.m. 8 centimeter dilatation. See, 3 p.m. if it is 8 centimeter dilatation means it crosses the right side of the alert line. That time we need some intention, like that maybe we have to take the action. It comes to obstructed labor or prolonged labor. That time we have to refer the case to the higher center. Next, contractions. See, contraction is recorded through small boxes for up to 5 contractions in 10 minutes. So there are 3 types of contractions: mild, moderate and severe contractions. Mild contractions less than 20 seconds. So that box should write with the dots. Next, moderate contractions 20 to 40 seconds. So that box should write with the lines. Severe contractions more than 40 seconds. That box should totally dark. So here you see, every half an hourly we should write the contractions. This is mild, moderate and severe contractions. See, normally contractions progresses in frequency and duration as the labor progresses along with dilatation. Weak contractions represents inadequate uterine activity. Such type of cases should refer to the higher center. See, interventions. Coming to the intervention, we have to write the drugs and IV fluids given. Here oxytocin 5 units in oral. So that treatment we are going to give. So we have to write here in the intervention box. Next, maternal condition. In this maternal condition, see pulse and BP. Pulse every half an hourly we should record. BP every 4th hourly we should record. Pulse should write with the dots and BP should write with the vertical arrow mark. See here the pulse from 80. See like this every half an hourly we should write the pulse. Normal pulse rate is 60 to 100 per minute. Tachycardia tells us about maternal distress. In early shock there is tachycardia, while in late shock there is bradycardia. See, coming to the BP should record every 4th hourly. Here you see at 80 and 120, here the recorded with vertical arrow mark. Above is systolic, below is diastolic. Here we have recorded every 4th hourly. See, normal BP is 100 by 60 to 140 by 90. In case of shock or bleeding, blood pressure drops. In case of hypertensive disorders of pregnancy, blood pressure is more than 140 by 90. Next, temperature. Temperature should record every half an hourly. See here 37 degrees Celsius. So normal temperature ranges from 36.7 degree Celsius to 37.6 degree Celsius. Rise temperature is indication of maternal sepsis. Fall temperature indicates the hypothermia. See, now today we have discussed about the simplified partograph. If you like, share, subscribe and comments. Thank you for watching this video.